Do you know the difference between a pelvic exam and a PAP test? This is such a common source of confusion. The myth is that every time you have a pelvic exam, screening for cervical cancer with a PAP test is done. And the reality is the PAP test requires special brushes and collection vial and is not always necessary at the time of a pelvic exam. A pelvic exam involves two parts. The first is visual inspection. This includes the external skin and the internal vagina and cervix. To visualize internally, a device called a speculum is utilized. Part 2 is the bimanual exam, which involves one or two fingers of the examiner inside the vagina to assess the vaginal walls and cervix. The second hand is placed over the abdomen to palpate the uterus and ovaries between the examiner's two hands. And this allows evaluation for any uterine enlargement, ovarian masses, adhesions, or signs of infection. Now, the PAP test. This is screening for cervical cancer, and it involves collecting cells from the cervix with a brush. Those cells are either evaluated under the microscope by a pathologist, which is called cytology, and or tested for high-risk strains of HPV. And our national screening guidelines recommend testing every 3 to 5 years, depending on your age and which tests are performed. And it's important to know that certain circumstances may warrant more frequent screenings. Finally, there are many other tests that can be done at the time of a pelvic exam, such as those for yeast infection or gonorrhea and chlamydia. So just because a swab was collected doesn't mean it's a PAP test. Now you know what to expect. At your next pelvic exam, talk to your doctor about what, if any, testing is recommended. Stay informed, be empowered, and live well.